My name is Dr. Boris Wagner. I am first author of the JBJS study Outcomes in Younger Patients with Femoral Neck Fractures, published alongside my colleagues from Edinburgh Orthopaedics. We did this study because hip fracture fixation in young adults is associated with high rates of complications, and there is limited long-term outcome data for younger adults undergoing intracapsular femoral neck fracture fixation. We were also building on a 2011 study from our centre, which identified comorbid risk factors for fixation failure in young patients with displaced femoral neck fractures. And we aim to therefore further explore the long-term outcomes and patient-reported outcomes in this demographic, as well as evaluating factors associated with fixation failure. In terms of findings, we analysed 112 consecutive patients under the age of 60 who underwent intracapsular hip fracture fixation over a 10-year period, and we documented the failure rates as well as collecting long-term outcomes at a mean of 7 years post-operatively for about 3/4 of the cohort. The patient-reported outcome measures we looked at included the Oxford Hip Score, the Forgotten Joint Score, the EQ-5D Visual Analog Scale, as well as the UCLA Activity Scale. We identified two distinct types of hip fractures in adults under the age of 60. Firstly, high-energy traumatic fractures in younger individuals, and secondly, low-energy fragility fractures in patients with advanced biological age who may have higher risk of fixation failure. At 77%, the majority of patients progressed to union without failure and had equivalent hip-specific function and health-related quality of life compared to age-matched population controls. However, almost 1 in 4 patients developed failure of fixation, with osteonecrosis being the most common complication, with a rate of 14%. These patients who had fixation failure had inferior health-related quality of life compared to those who achieved union without failure. Strikingly, 1 in 3 patients required further operations, with removal of hardware and revision total hip arthroplasty being the most common operations. In terms of unanswered questions, I think there is a need for prospective studies to evaluate different fixation strategies and their impact on long-term outcomes in this demographic, and identifying risk factors associated with fixation failure may provide long-term benefits for young adults with hip fractures and their long-term outcomes. Thank you.